Assalamualaikum and greetings. My name is Mizati. I'm a general surgeon and lecturer in the Faculty of Medicine, UiTM. So I'll just give a short talk about the risk factors for thyroid carcinoma. Okay, so the first thing is it has a preponderance to the female sex, whereby a female would 3 times be more likely to get thyroid carcinoma than a person who is male. It occurs within the age of 20 to 55 for papillary thyroid carcinoma and follicular thyroid carcinoma, with a peak incidence of in the 40s in females and slightly older in the male population in their 50s. And the plastic carcinoma occurs in the more elderly population above 60 years old. For medullary thyroid carcinoma, especially those that has inherited genetic mutation, then this would occur in the pediatric population. So next is a positive family history. Although more than 90% of thyroid carcinomas are sporadic, to have a family member having thyroid carcinoma would give an increased risk to that patient. Familial thyroid carcinomas tend to be more aggressive than the sporadic type. In patients with genetic mutation, in particular of the RET proto-oncogene, this would give an increased risk for medullary thyroid carcinoma. A proto-oncogene is actually regulates normal cell growth. So a mutation in the proto-oncogene results in being an oncogene, thereby it stimulates carcinogenesis. So a patient with a genetic mutation of the RET proto-oncogene would have 100%, almost 100% penetrance of medullary thyroid carcinoma. That means that they will get medullary thyroid carcinoma. So certain inherited syndromes are also gives an increased risk of thyroid carcinoma. For example, autosomal dominant hereditary syndromes like FAP, Carney complex, and Cowden disease. So FAP is familial adenomatous polyposis, whereby the patient would get multiple colon polyps, which leads to colon cancer. So these patients would have an increased risk of developing papillary thyroid carcinoma. Carney complex are a syndrome whereby the patient would have benign myxoma, skin pigmentation, and endocrine disorders as well. So these patients would have an increased risk to papillary thyroid carcinoma and follicular thyroid carcinoma. Patient with Cowden syndrome would have multiple hamartomas and an increased risk to get papillary thyroid carcinoma and follicular thyroid carcinoma. In MEN syndrome, MEN, which stands for multiple endocrine neoplasia syndrome, this is particular related to familial medullary thyroid carcinoma, whereby almost always there will be mutation in the RET proto-oncogene as mentioned. So MEN2A, the patient would have pheochromocytoma, hyperparathyroidism, and medullary thyroid carcinoma. In MEN2B, the patient would have mucosal neuromas, pheochromocytoma, and medullary thyroid carcinoma. Radiation exposure is also is an established risk for thyroid carcinoma. So ionizing radiation would interact with the DNA, causing the DNA strands to break and cause somatic mutations, and this would lead to carcinogenesis. Okay, so it is basically related to the degree of exposure, as in the severity of the severity of the exposure, and also the duration of the exposure as well. So for example, certain disasters that occur would lead to leakage of the of radiation to the surrounding environment and population. For example, the disaster that occurred in the Chernobyl power plant in 1986, whereby some defects in the structure caused an explosion and leakage of the ionizing radiation material to the surroundings over quite a large diameter and population. Also, for example, what happened in the Fukushima nuclear power plant as well in 2011, whereby earthquakes and tsunami caused damage to the power plant. And also, for example, during World War II, whereby an atomic bomb was dropped in Hiroshima and Nagasaki. So it seems that it affects children more, whereby it is thought that the thyroid cells in children are more radiosensitive. So even after a long period of time, there is a lifelong exposure risk to get thyroid carcinoma, especially when the patients, when those that have been exposed to these radiation when they were children, okay, as opposed to they were exposed when they were an adult. Treatment that gives any radiation to the head and neck, for example, treatment for Hodgkin's or non-Hodgkin's lymphoma, would also incur a risk. Okay, all right, so these are the main risk factors for thyroid carcinoma. Hopefully, you'll be able to answer the MCQ that has been prepared for it. Thank you.